They are the heroes on the front lines of the fight against COVID-19 in our city, leaving their families behind to take care of ours. In our Frontline Diary segment today, we connect with Dr. Juthaporn Cowan, who cares for patients with infections at the Ottawa Hospital and is also part of the team behind some critical research related to COVID-19. Good morning, Dr. Cowan. Thank you so much for joining us.
Good morning to you as well.
So tell me about your work at the hospital these days.
So 50% of my work is clinical work, meaning seeing patients with infections and with immune compromised states. And the other 50% of my work is all about research. I previously did research in infection prevention in immunocompromised population, but with the COVID-19 pandemic, the research projects have changed, obviously, towards preventing COVID-19 infection.
Tell me about what you're looking for in your research with regards to COVID-19.
Right. So currently, the main projects that I have right now are called the LEFT project, and the other one is called No COVID project. So the LEFT project is the project that we are looking at the long-term effect of COVID-19 infection to physiological and psychological health outcomes. And we are asking patients who survived COVID-19, whether they were admitted to the hospital or not, to participate in a study looking at their lung function, their heart function, and answer some of the questionnaires about their psychological health at 3 months, 6 months, and 12 months. And we're hoping to see whether there is any impact at all to these patients, and whether there are any differences among people who were admitted and who did not get admission, and how long the effect lasted for. And in the end, we would like to be able to find an intervention or procedures that we can help minimizing the impact of the infection to the physiological and psychological health.
Wow.
The second, sorry, and the second project,
work.
Yes.
Sorry, and the second project?
Okay, and the second project that is at the conceptualized state right now is to try to use engineered small molecules that bind to the virus. And we would like to spray this product into the nose of people who have not gotten infection in order to prevent them from getting the infection. Will be similar to vaccine, but different in the sense that this is not inducing long-lasting immunity like vaccine. And we hope that this can be a bridge before vaccines are available.
You've got some pretty critical work on your hands there, and I know you're also a mom. So I want to ask you how COVID-19 and the work you do at the hospital has affected your life as a mother.
Yeah, so I was actually on call for infectious disease service for about 2 weeks, just about before the peak of COVID-19 infection. I think that was 2 weeks after the March break. And we did not know how many people there were going to be at the hospital, how busy we were going to be. I was worried for my family, but mostly for my senior colleagues. And for my family, when I was on call, I did not allow my children to hug me or to kiss me, which was hard for them.
That must have been so hard. You couldn't snuggle your children at the end of a day.
No, they were very upset.
And I understand that your children have taken all of this and put some feelings they're having into art, and that you're quite proud of them for that. Can you tell us what your children did?
Yes, so my son drew a picture of the virus, and he played with the word of COVID-19 to be 91 DVOC, so spelling backward. And he also put, I'm not sure why, he put MAMA-VID, which is Mama Viral Infectious Disease. I think that's probably he's representing my career as a doctor in infection, fighting off this virus.
Certainly.
And my daughter is very kind, and she just wants to spread the love around. She drew a picture of a heart, and I shared with some people.
That's some beautiful art, Dr. Cowan, and certainly I would imagine it helps keep you going on the tough days with a lot of work on your plate right now. Thank you so much for joining us today and sharing these stories with us and telling us about your critical work at the hospital. We appreciate your time.
Thank you very much. Have a good day.